Sorry to wake you from your sleep. Hello, it's Sarah again. How are you feeling? That's wonderful. That's wonderful. Well, you had your surgery yesterday, and as you know, it was a success. I had no problems removing that gallbladder. Okay, it's all gone now, so it won't give you any more problems. Okay, now I'm just going to check your notes just to see how you've been doing since I last saw you. Okay, and I'm going to give you another examination today, check your dressings, and if all's well, we'll see about getting you discharged. How does that sound? Yeah, of course, no one wants to stay in hospital, do they? No. Well, you just relax there a second and I'll just check through the notes here. Okay, just check your last observations. So they were all normal by the look of it. Okay. Just checking what medicines you've been given. So you last had some anti-nausea medication yesterday after surgery. You just felt a little bit nauseous afterwards, which is normal. Has that calmed down now? That's good. Okay, so you've not had any anti-nausea meds today. Okay, how's your pain level on a scale of 1 to 10? 1 being not very much, 10 being unbearable. Okay, about a 4. Mainly when you move. Okay. Right. So I can see that you've actually taken in some food and drink, which is wonderful. So you've had some soup, yeah? And some, what did you have? Oh, and some mashed potato as well. Lovely. Okay, and you've had some scrambled egg for breakfast. That's more than I've had. Okay, right, let's have a look here. The temperature was all fine. Okay. Oh, it's perfectly fine to feel tired for a little while after general anaesthesia. Don't worry, that can last for several days. Yeah, that's why we recommend that you don't drive for a while after you've had an operation, because it can actually affect your reactions and your thoughts and how alert you feel, okay, for some time afterwards, even though you're well enough to go home. Yeah, it's surprising how long the effects can last in some people anyway. Okay, so we've got that your friend will come and collect you. Yeah, when you're ready, that's good. Okay. But obviously at first we just need to make sure that you're all tip-top. Okay. Right then. Would you like a little drink of your water? Yeah, there we go. A drink of that. Save you reaching out and getting it. There. Perfect. Just say if you need some more. Okay. So I'd just like to do these few little checks, if I may. So firstly, I'm just going to check your temperature by popping this in your ear. All right? Okay. Pop that in there. Okay. Okay. That's perfect. Normal temperature, so that's good. No, we don't often prescribe antibiotics after this surgery. It's not usually of any benefit. If you do start to feel unwell in any way or get a temperature, obviously call the hospital, but we don't normally prescribe now. We used to, but we don't anymore. The only thing I'll be sending you home with today is some painkillers. Okay, if you need them, something a little bit stronger than paracetamol. You may not need them, but we like to make sure that you've got something if you are feeling a little bit uncomfortable. Okay. So just open wide for me? I'm just going to have a little look in your throat just to make sure you're okay after being intubated. Does your throat feel a little bit sore and scratchy? Yeah, that'll wear off very quickly. That's just from where we intubated you during the operation, okay? Just so we could get the air down and the gases, okay? Alright, so just let me just have a little look in there. That looks fine. Any pain when I press around? No, okay. Alright. Just have a little check around. Just under the jaw there, make sure everything's fine. Got no pain in your face? Okay, that's wonderful. So I'm just going to pop this on your finger, the pulse oximeter. Okay, just have your finger on your right hand. There we go. Okay, that's perfect. Oxygen sats are at 99, so that's wonderful. Pulse is normal at 75, that's perfect. Okay. I might just have a little listen to your chest while I'm here. Okay. You've not felt like you needed to cough or anything unusual, have you? No, that's good. Just going to pop this on your chest, okay? I'll give it a little warm up first. Okay. Are you comfortable with how you're sitting? Alright then. Just take a nice deep breath in and out. And again, in and out. Again. And again. Again. That's wonderful. Okay, just round the back a little bit there. And again. Again. Round there. Okay. Could you just give a little cough for me? Okay, I know that might be a little bit sore with having the surgery. That sounds good. Okay. Let's just check your blood pressure while I've got the stethoscope in my ears. Okay. Alright. Just going to pop this onto your left arm first. There we go. Wonderful. Let's get that ready. Just pop the stethoscope on and just inflate that cuff now. Just go a little bit tight. That's wonderful, very, very healthy. 122 over 80. Let's just try the other side. Okay. Put my stethoscope on there and inflate again. Marvellous. It's more comfortable, isn't it? Okay. Jot a couple of notes down there. Alright. Okay. So I'm just going to have a little press around your abdomen. You are going to be sore, I'm not expecting you not to be. Okay, but I'm just going to feel for a few particular things. Alright? Okay. Do say if it is too sore for you to tolerate. Alright, okay. You're right there. Okay. Okay, good. Just a little bit lower down, okay. You are going to feel a little bit bloated for a while because of the gas that was pumped into the abdominal cavity there. That will dissipate over the next few days, so you just might feel a little bit uncomfortable if you don't wear loose clothing. Okay, but it will calm down. Alright, how does that feel? Okay, a little bit sore, yeah, that's okay. A little bit sore there, yeah. I'm just going to take a close look just below there. Yeah, that's alright. So everything seems okay there, nothing seems too painful for you. Obviously there are going to be areas that are very tender just at the moment. Okay, but what I'm going to do, I'm happy so far with what I've found, so I'm going to change the dressings, okay, very gently, clean them up. If everything looks fine there, all your obs are checking out fine, you've eaten, you've been drinking plenty, which is really good, okay, you've actually opened your bowels and bladder as well, which is wonderful, and if I'm happy with what I find underneath the dressings, then I will get you discharged today, if that's okay. Yeah, you will need to rest for a few days, but the beauty of the keyhole surgery is that you don't have to spend days in hospital and you haven't got huge big scars. You've just got 4 little scars which will soon heal. Okay, so let me give you another little bit to drink. There we go. Yes, it's very warm in here, and also having anaesthesia can make you feel rather thirsty. Some more? Yeah. The nurse has noted that you've been drinking really, really well, so that's what we like to see. Yeah. And really there's no special diet that you'll need. I would stay off fatty food for a while, too fatty food, but you should be able to eat pretty much as normal. We can survive well without our gallbladders, they're not essential, but yours did have a lot of gallstones, which was blocking the bile duct, hence the pain and illness that you were feeling. There you have another drink there. Yeah. But that's all gone now. No more problems with that. Okay, right. I'll just go and grab some dressings and I'll take a good look at your abdomen there and get you all freshened up. Okay, be back in a couple of minutes. Right then, shall we take a look at my handiwork? Okay, so I'm going to very gently pull off the 4 dressings, okay? They're the little incision points. Alright, it shouldn't hurt though, okay? Not very much anyway, maybe a little bit of a pull as I remove it, but I'll be very, very gentle, okay? Oh, here we go, here's the first one. Okay. Alright. Okay. Good. Another one. Okay, that's two. Very gently removing that. Okay. And last one now. You're doing really well. Okay. That's perfect. Okay. They're super, super sticky. Let's put that down there. Okay. Right, then I'm just going to firstly take a little look around. Well, there's no weeping, so that's wonderful. From what I can see. Okay, I'm just going to shine my light a little bit there, just to give me a bit of a clearer view. To give that a little wipe off now. I can't see any redness around. You've got no itching from the dressings, have you? That's okay. We don't want you to be uncomfortable. Sometimes people can react to adhesives. Very special, refreshing dressings here to clean you up. Alright, just relax, my lovely. I'll be so gentle, don't worry. Okay, very gently wiping around. Is that okay for you? Tell me if you need me to stop, okay? Oh, I'm sorry, it's a little bit sore. You're doing really well. Okay, just go down here to this one. They do have a lovely smell, don't they, these wipes? Okay. That's looking wonderful. Don't be worried if you see a little bit of bruising coming out, that's quite normal. Okay. It doesn't mean we've been heavy-handed with you. It's just a natural reaction to obviously when we're pushing a little bit onto the surface and making little incisions and moving the laparoscopic tools around. Okay. Right, okay. So I'm now going to replace those dressings, right? Some nice fresh ones. We'll also give you some dressings to change if you like. You can take those home with you and just gently change your dressings tomorrow. Okay. feel alright for you, my lovely? Good. Nice and gently. Okay. Alright, that's another one. Perfect. Okay. You feeling alright? On there. Okay. And the last one, which is just around the belly button area. Slightly bigger dressing there. Alright, let's pop this one down here. Okay, there we go. All done. Looking wonderful. Let's just write a couple of notes there. I can hear your tummy rumbling. Are you hungry? One thing that I will say is that sometimes after this operation you might find you get a little bit of diarrhea for a short time. It can be just a couple of days, or it can last a little bit longer. On the very rare instance it can last for several weeks or more, but usually it resolves very, very quickly. Okay, just as your body adjusts to the levels of bile that are running through your system, because the gallbladder regulates the amount of bile, but obviously that's not there anymore, so it can vary quite a bit, and a little bit more can get through, which can cause some problems in the digestive tract. Okay, yeah, not saying you will, but look out for it, and it's not anything to worry about, unless of course it's very painful when it doesn't resolve. Alright, okay. And like I said earlier, the soreness will last for a few days, but just take it very, very gently. Right, I'm going to remove your cannula in a few moments. I'm just going to prepare this paperwork for your discharge and the prescription. Okay, for the painkillers and obviously the dressings. Alright, okay, so let's just complete that. Alright. Right then. So I'm going to remove the cannula dressing very gently, and then I'll be gently removing that cannula. Okay? Perfect. We keep it in just in case you need other medications, but you've been off the IV now for several hours, so you're okay. Right, here we go. Very gently just removing this. This can sting just a little, I'm afraid. Just removing the cannula. Okay. You're a trooper, aren't you? Perfect patient. I'm now very gently going to remove this cannula. Okay. Okay, let's just hold that on there for a second. Sorry, it can sting just a little. There we go. I'm going to put a nice comfortable dressing over that now. Again, you might notice a little bit of bruising and swelling where the cannula's been in, but that's perfectly normal. Okay, this one actually looks very good. Sometimes they can bruise quite badly, but that's very, very good. Okay. Just gently peel this off. There we go. Keep your hand nice and still for me, my lovely, and I'll get that popped on there. There we go. Well done. How does that feel? Give your fingers a little wiggle for me. That's wonderful. Okay. Like a little bit more to drink. There we go. Okay. That's perfect. Okay. Well, you're all ready for discharge, so we'll get your friend to come and collect you. Stay where you are just for the time being and I'll send the nurse along. Alright, and we'll get some meds for you from the pharmacy to take out with you. Okay. Obviously, we'll give you a leaflet and the nurse will explain a little bit more, but obviously there's numbers to call if you aren't feeling well when you get home. Okay. We will have a word with your friend just to say to drive very, very carefully, obviously, on your way home. Sometimes after general anaesthesia and the motion of a car can make some people feel a little bit dizzy or nauseous, and also we don't want any discomfort around your surgical sites there. Okay, so just very gently drive home. I'm not saying your friend is a maniac, but you know, really, really carefully drive and move very, very carefully just for a few days. Just go home and rest. Okay. Try and drink, you know, water, simple things. You're okay to have a little cup of tea for today. After that, you should be fine. As I said, you can eat your normal diet, perhaps stay off anything too spicy for a few days. Fatty foods, you might find at first they're a little bit harder to digest, so I wouldn't go too much on fatty foods straight away. Okay, you can have a little bit, but not too much. But after a few days, there really isn't any reason for you not to go back to a normal but healthy diet. Obviously, we recommend everybody has a healthy diet, of course. Yeah, but don't drink any alcohol for a few days. Yeah, obviously, alcohol is very hard for the body to process. It's a gastroirritant, and also you've had anaesthesia as well, so we would recommend that you don't drink for a while. Okay, if you do drink alcohol, that is. Okay, not very often, so it's not going to be an issue for you. So do you have any questions? Okay, well, it's been wonderful to be able to make you feel better. Okay, and I'm happy I was able to come back today and do this and check you over. Okay, so I'll get my nurse to come and give you a little chat and check things out for you, help pack away your things, and I'll get you out of here in an hour or so maybe. Okay, it all depends on how quick the pharmacy can issue your medicines. They are particularly busy as always, but you know, we'll get you out as soon as possible. Yeah, and if you want any more refreshments in the meantime, just ask the nurse. Okay, all right, my lovely, you take care. And I'll check you back at my clinic in a month's time, if that's all right. Okay. Take care. Bye-bye.